So our patient is John. He's a 23-year-old collegiate baseball player. He's a right-handed pitcher, and recently he suffered a right slap lesion on his shoulder when he dove into home plate. In his free time, he enjoys fishing and playing golf, and he's really eager, since he's a junior, to return for his senior season. Sliding into home plate, John was unable to get his hands fully extended and ended up landing with all of his weight on his right shoulder. When landing, he immediately felt a pop and said he felt like his shoulder was kind of loose. He continued to play the game, but at the end of the game, the head athletic trainer assessed him and performed the O'Brien's test, the anterior and posterior load shift test, and the sulcus sign, which all came back positive. From then, he ordered an MRI, which came back inconclusive, so they had to perform an arthroscopic investigation to determine that he did indeed have a slap tear.
The glenohumeral joint is a synovial ball and socket style joint that is responsible for connecting the upper extremity with the trunk, and it is one of the 4 joints that make up the shoulder complex. This joint is formed by the combination of the head of the humerus and the glenoid fossa. The glenohumeral joint is considered the most mobile but the least stable joint in the body, and is usually the most commonly dislocated joint. In the capsule, the lateral attachment of the joint attaches to the anatomical neck of the humerus. Some of the muscles that control the humeral head in the glenoid fossa include the supraspinatus, infraspinatus, teres minor, and subscapularis, which make up the rotator cuff muscles, and they are the main stabilizers of the shoulder joint. Other muscles that surround the glenohumeral joint and that allow for greater movement and directions include the anterior, middle, and posterior deltoids, the teres major, latissimus dorsi, pectoralis major and minor, the biceps brachii, and the triceps. All of these muscles allow for motions that include flexion, extension, abduction, adduction, internal rotation, external rotation, horizontal flexion, and horizontal extension. These motions are limited by ligaments in the joint that are composed of the transverse humeral, the coracoid humeral, the superior, middle, and inferior glenohumeral ligament, and the close packed position for the glenohumeral joint is abduction and internal rotation. There are 2 approaches for treating labral tears. One of them is the surgical approach, or the operative treatment, which involves making small tears or frays through arthroscopic surgery. If more structures are damaged during the mechanism of injury, the surgeon must reattach those surrounding structures, involving more extensive surgery. One of the pros of this treatment is that the athlete will be able to return to full play, and he would be very likely to achieve a pre-injury level. One of the cons is that the treatment will have to consist of addressing the issue that caused the injury in the first place, which would include strengthening the glenohumeral joint and stretching the posterior capsule of the joint. The second approach is the non-operative treatment, which involves getting rid of symptoms temporarily but won't fix the labral tear. This will allow the athlete to recover faster and return to sport-specific activities quicker and competition in 4 to 6 months. One of the cons is that they would be very unlikely to perform at pre-injury level, and this treatment involves corticosteroid injections, non-steroidal anti-inflammatory medications, physical therapy, focusing on the post.
So a slap tear can be a chronic or an acute injury. Chronic usually occur from overhead athletes, such as pitchers, as the repetitive motion of continuously throwing, or acute usually happen from food. For phase 1, our general goals are to protect and repair the incision that was made, begin early range of motion, and really just reduce the inflammation and pain. We're going to work on some early range of motion exercises, such as pendulum exercises. Our other early exercises are shoulder shrugs, shoulder blade pinches, isometric internal and external rotation, ball squeezes, rhythmic stabilization, and just include some cardio with a stationary bike. Miguel's going to go ahead and demonstrate shoulder shrugs for us. And then he's going to demonstrate shoulder blade pinches. You essentially just take your shoulder blades and you try to touch them together in the back. You can see his shoulders go back. And then we'll get a posterior view. You can see his shoulder blades really come together.
For phase 2 or weeks 4 to 8, the sling should be discontinued and PNF exercises can begin. But stresses on the bicep muscle is still kept to minimum. Some of the exercises that we included for this phase are the side-lying external rotation, internal rotation, external rotation, abduction, adduction, flexion, and extension with TheraBand, proprioception or perturbations, quadruped, wall ball shoulder circles, prone row, and for the cardio part, we did walking on a treadmill. Here, Caitlin will be demonstrating side-lying external rotation exercise. We can see that she is keeping her elbow close to her body and just externally rotating the elbow flexed at 90 degrees. She will also be demonstrating the quadruped exercise.
You can shift your weight forwards or backwards to increase the load on the shoulders.
And now she will demonstrate the wall ball shoulder circles, which you can progress by using a heavier ball, and you can regress by using a lighter ball.
So in phase 3, we should be about approximately 8 to 14 weeks. Our general goals, we should get full range of motion back. We should be nearly full strength. We can start performing exercises like the body blade patterns. We can finally start like dumbbell curls and start working out those biceps. We can start using the cardio, the UBE, start light jogging. We can begin scapular stabilizing exercises like lat pull downs and rows, and we can start more advanced TheraBand work like W's and T's, forward punches, diagonal up downs, internal external rotation at 90 degrees. Miguel's going to demonstrate the body blade and the different shoulder patterns that you can use. You can go out and in, up and down. This just really gets your proprioception working and really just starts early strength in that shoulder. Okay. Next, Miguel's going to demonstrate bicep curls just with like a 3-pound dumbbell. Slowly lifts up, goes down. This is really going to strain that bicep tendon, but at this phase, it shouldn't be an issue. And really just works that bicep strength.
For stage 4, we should be getting to weeks 14 to 18. Some general goals include working on improving strength and endurance, and working on scapular strength. Some exercises that will help achieve this would include lateral raises. Here we see Caitlin demonstrating the lateral raises with 3-pound dumbbells. Other exercises would include chest flies, shoulder press, that was dumbbell press with shoulder press with 2 3-pound dumbbells. And we would also work on improving dynamic stability and start on sport-specific exercises such as hitting drills, light throwing, base running, and one-hand weighted ball tosses. We would also begin with upper extremity plyometrics, such as wall throws with medicine ball, and bench plyometric push-ups, which we'll see Caitlin demonstrating here. You see her movements being done in an explosive
and quick manner.